Welcome back to another episode of HealthCap Weekly Wrap.
Yeah, we've got a full lineup today. Some really important updates that senior living professionals are going to want to hear.
We're starting with a hot topic: enhanced barrier precautions. There's growing scrutiny, but also a lot of confusion about how to implement them correctly.
Then we're diving into an insulin option that doesn't require strict refrigeration. It could really help communities streamline storage and reduce waste.
Right, and after that, we'll head to Iowa, where licensing rules for nursing home administrators just got a big shakeup.
We're also going to talk about a new behavioral health learning series. It's designed specifically for nursing home staff and focuses on practical skills like de-escalation and communication.
Super useful stuff. And if you're working with residents at risk for falls, we've got a clinical tool that helps predict osteoporotic fractures. Definitely worth checking out.
And finally, we'll wrap with a legal update on arbitration agreements in long-term care. There's been a new court ruling that could have big implications.
Let's get into it.
All right, let's kick things off with enhanced barrier precautions. This one's getting a lot of attention lately.
Yeah, McKnight's just reported that scrutiny around enhanced barrier precautions is ramping up, even as many communities are still trying to interpret what CMS really expects.
The big issue is confusion. While the guidance calls for gown and glove use during high-contact care for certain residents, there's a lot of variability in how facilities are applying it, and surveyors are taking notice.
Right, and that includes situations like shared shower rooms, therapy gyms, and even group activities. Some communities are going above and beyond, while others are unsure where the line is.
One infection preventionist in the article said she sees both overuse and underuse happening at the same time, like gloves being worn unnecessarily in the hallway, but missed during actual resident care.
Exactly. And CMS has acknowledged that facilities have some discretion, especially when trying to balance infection control with a home-like environment. But that gray area is what's making things tricky.
Which is why documentation, staff training, and consistent practices are so important right now. It's not just about having a policy, it's about applying it reliably.
To support that, we just updated our Enhanced Barrier Precautions Toolkit for 2025. It outlines CMS guidance, provides definitions, and includes examples of when EBP should be used based on risk factors like wounds or indwelling devices.
So if you're revisiting your protocols or preparing for survey, you can find the toolkit on our Resource and Education Center.
Our next story is about insulin storage, and this one could really help simplify medication management in senior living communities.
Yeah, Pharmerica recently highlighted that not all insulin needs strict refrigeration. In fact, some insulin products can be stored at room temperature for up to 31 to 56 days once opened, depending on the brand.
That's a big deal, because as anyone in long-term care knows, refrigeration space can be limited. And when insulin is stored improperly, it often ends up being wasted.
Exactly. And beyond that, having more flexibility with where and how insulin is stored can actually improve access, especially during med passes or when residents are away from their rooms.
The document lists several common insulins that fall into this low refrigeration category, like Lantus, Levemir, Novolog, and Humalog. Each has specific guidelines, so it's important for nursing staff to know the details.
And this isn't just about convenience. It also reduces the risk of administration delays and supports better resident care by ensuring insulin is available when it's needed.
Pharmerica also encourages reviewing manufacturer instructions regularly and training staff to follow community-specific protocols.
So if your team hasn't revisited insulin storage practices lately, this might be a good opportunity to do a quick check-in.
Let's keep going. What's next?
All right, this next one is out of Iowa. And it's about a change that could impact how nursing home administrators are hired and retained.
Yeah, the Iowa Capitol Dispatch reported that the state is reducing the educational and licensing requirements for provisional nursing home administrators. The goal is to help address staffing challenges and provide more flexibility for communities.
Under the new rule, individuals can now serve as a provisional administrator for up to 2 years, up from the previous 1-year limit. That gives communities more time to work with someone who's still working toward full licensure.
So what do people need to do to qualify?
To qualify, a provisional administrator must be at least 18 years old, pay a $120 fee, and have no history of disciplinary action in any licensed profession. They also need to be knowledgeable about the responsibilities of the role, but there's no minimum education level or exam requirement for this provisional license.
That's a big shift. Full licensure still requires a bachelor's degree, passing an exam, and completing training or practical experience in a healthcare setting. So this provisional path opens the door for a broader range of candidates.
But here's the thing. Stepping into an administrator role without formal training can be overwhelming. That's where we can help.
That's right. At HealthCap, we offer free educational courses that support leadership development in long-term care. That includes a 3-part leadership series, plus other training like root cause analysis, managing difficult residents and families, burnout and retention, and more.
Yeah, these resources are a great supplement for provisional administrators. And honestly, for seasoned leaders too. They're all online, self-paced, and focused on real-world challenges communities face every day.
So if you've recently onboarded a provisional administrator, it might be a great time to connect them with those tools.
This next one is a great resource for anyone working with residents who have behavioral health or substance use needs.
Yeah, the Behavioral Health Action Network, part of the Center of Excellence for Behavioral Health in Nursing Facilities, just launched a free 3-part virtual learning series for staff in CMS-certified nursing communities.
The focus is on building practical, person-centered skills that can help staff respond more effectively in day-to-day care. The sessions cover assessment, communication, and de-escalation techniques, areas where many teams are looking for more support.
It's designed for frontline staff, but honestly, anyone working in senior care can benefit from it. Each session includes strategies that can be applied immediately on the floor.
And the timing couldn't be better. Behavioral health challenges are becoming more common across senior living, and staff often say they feel undertrained to handle those situations.
This series helps close that gap, and it's also aligned with CMS's broader focus on behavioral health, so it's a great way to show proactive engagement during survey.
If your team hasn't signed up yet, the sessions are virtual and free to attend. You can find the details through the Behavioral Health Action Network website.
All right, this next one is a clinical tool that could be really useful for nursing teams and providers in senior living.
Yeah, Medscape features a resource called the Dubbo Osteoporotic Fracture Risk Calculator. It's designed to estimate a resident's risk of sustaining an osteoporotic fracture over the next 5 or 10 years.
The tool is based on data from the Dubbo Osteoporosis Epidemiology Study out of Australia, which tracked fracture outcomes in older adults over time. It takes into account age, gender, bone mineral density, and history of previous fractures.
And while it's not meant to replace clinical judgment, it can be a great way to help guide conversations around fall prevention, bone health, and even care planning for high-risk residents.
Exactly. If a resident shows elevated risk, communities might consider interventions like vitamin D supplementation, physical therapy, or reviewing the resident's environment for fall hazards to reduce the chances of a serious fracture.
The calculator is easy to use and available for free on Medscape's website. It's especially helpful for clinical teams who want an evidence-based way to prioritize residents for preventive care.
And let's face it, preventing just one hip fracture can make a huge difference in someone's long-term quality of life.
If you haven't seen this one yet, it's worth bookmarking and sharing with your clinical leads.
All right, we're wrapping up this week with a legal story that could have implications for admissions and dispute resolution policies in senior living.
Yeah, McKnight's reported on a federal appeals court ruling that upheld a nursing home's right to enforce an arbitration agreement, even though the agreement wasn't included in the resident's official admission packet.
The case involved a Tennessee community where the arbitration agreement was presented and signed separately from the main admission contract. The resident's family argued that because it wasn't part of the core documents, it shouldn't be enforceable.
But the court disagreed. They ruled that as long as the agreement was voluntary, clearly explained, and signed, it still holds up, even if it was signed during or just after the admission process.
And this is where having clear, consistent practices really matters. Arbitration agreements are still allowed under CMS rules, but they have to be completely voluntary, clearly written, and not a condition of admission.
To help with that, we've put together a comprehensive arbitration toolkit at HealthCap. It includes a sample policy, do's and don'ts for drafting agreements, a checklist for how to introduce and explain them, and state-specific legal guidance.
Yeah, it's a great resource to make sure your process is transparent, resident-centered, and compliant with federal and state expectations.
So if you're reviewing your admissions workflow or just want to make sure everything's up to date, the toolkit is available on our Resource and Education Center.
And with that, we've reached the end of this week's roundup.
Thanks for tuning in to this week's episode of HealthCap Weekly Wrap.
If any of the stories we shared today sparked interest or you'd like to dive deeper, you can find more details with links to the articles in the weekly roundup on Angie's blog at healthcapusa.com/Angie's-blog.
We'll be back next week with more updates and insights to support your work in senior living communities.
Until then, take care and thanks for all you do.